Hello everyone, my name is Ashley Allred and I'm the Prevention Program Specialist over at the Substance Abuse Council. Today we're going to be doing a Narcan training in order to obtain a Narcan kit. You will be able to receive a kit from these locations. The locations above are the Substance Abuse Council, Summit Point, the Substance Abuse Prevention Services, all thanks to the Battle Creek Community Foundation for funding this program. Before we get started, we want to give you a little background on what opioids are and how we got to this point. So we're going to start off with, how did the opioid epidemic begin? It started around in the early 1990s when there were very well-known pain specialists who were writing manuscripts and different articles saying that opioids should not be feared and that they will not lead to addiction. Many people looked at these articles and manuscripts in the medical field and believed this and were totally comfortable with prescribing opioids. In 1995, there was a campaign called the fifth vital sign, which is pain. This was well known in many organizations and it started being used in every doctor's office in America. People started knowing about the vital sign and doctors would ask, what is your pain on a scale of 1 to 10? There were very strict standards towards opioid prescription and pain medication prescriptions in hospitals and doctors' offices. Because of this, doctors' offices and hospitals were worried that if they didn't prescribe enough opioid medication, that they wouldn't get the funding that they need. So, because of this, they were overprescribing and making sure that they reached their quota of certain pain medications that they prescribed in order to receive funding. Now that we have an understanding on how the opioid epidemic started, that's a pretty large topic, but now we're going to go to the individual. We're going to talk a little bit about how an addiction starts and just what an addiction is. Addiction is a chronic brain disorder. This is a chronic brain disorder because after using for a very long time, it is changing how the brain works. It alters the reward system in the brain. So instead of doing good behaviors, doing self-care, they're going to be doing things that really aren't good, which is using the drug and overusing the drug. The brain remembers what it is like to use the drug. So this triggers their reward system. They're constantly thinking about how that pleasure is when they're using, and that's a constant feeling. So they may be trying to do other things, they may be trying to get better, but that feeling of wanting that pleasure is always there. When we think about dopamine, our dopamine levels are typically pretty low in our normal life. But when you use a drug, the dopamine levels can increase by 100 to 200%. So imagine feeling so good that you want to feel that way all the time. That's how they're feeling and that's how their brain has caused them to think. Don't worry, we're almost to the training. We've talked a little bit about the epidemic and about addiction, but we really just wanted to address harm reduction really quick before we get into it. So Narcan is a form of harm reduction because if it's prescribed with the opioid itself, it can save a life. Opioids are typically prescribed in pill form. However, it can be injected as well. When using the form of injection, there's a much higher chance that hepatitis A, hepatitis C, and HIV can be transmitted. Another form of harm reduction would be making sure that people have clean needles and clean syringes so that these diseases don't get transmitted in our community. I mentioned that Narcan is harm reduction, but what is Narcan? So Narcan is a nasal spray that's injected into the nose. But what it does is it goes into the brain where the opioid is and it reverses the effect that it has. This reminds the person that they need to breathe. Now that we got all of that information out of the way, we're going to talk about the actual overdose now. So there are 4 situations that increase the risk of overdose. These 4 situations are mixing, tolerance, quality and quantity, and using alone. Let's start off with mixing. When you mix uppers and downers, it's really confusing on the brain. You're using a depressant and you're using something that gives you a bunch of energy. These do not collide very well. So this really increases the chance of overdose. Make sure that if you are using, you do not mix uppers and downers. You just stick to the one. Next is tolerance. So when it comes to tolerance, not many people know this, but after 3 days, you lose your tolerance to opioids. This may range, but for a wide variety of people, it's 3 days. It doesn't matter how long you use. So for example, if someone was using before they were incarcerated, and if they were in jail for even 3 days and they get released, if they use the same amount that they used before they were incarcerated, they have a high risk of overdose and even death. So next we're going to move on to quality and quantity. We're going to mainly talk about fentanyl here because fentanyl is a very pressing issue in many communities. So there are 2 types of fentanyl. There's illicitly manufactured and there's legally manufactured. When you use an illegally manufactured dose of fentanyl, this is almost 100 times more potent than even morphine, so it can cause death almost immediately. Many people don't know that they're getting illicitly manufactured fentanyl. So it's important to know where the drugs are coming from, who you're buying from, and hopefully get it from a very trustworthy source because fentanyl is very dangerous. The last situation is using alone. We want to encourage anyone who is using to not use alone. Make sure that you let a trusted individual know that you are planning on using and have Narcan ready in case anything goes wrong. Do not lock your doors and do not hide from other people because there's a high risk of overdose or passing away from overdose. The last thing is that there is a helpline called Never Use Alone. You can call this number and use, and they will stay on the line with you to make sure that you do not overdose. And if you do, they can get help. Now that we know the risks that could cause an overdose, let's look at the signs of when an overdose is occurring. So the acronym that you're going to want to remember that could save a life is BLUE. BLUE stands for breathing, lips, unresponsive, and eyes. So the breathing part, you're going to notice that they're breathing erratically. You may hear gurgling sounds, or you may not hear them breathing at all. For lips, you're going to notice that their lips are blue and that their fingertips are also blue because not enough oxygen is going to the body. The unresponsive is saying that when you're trying to call out to them or you're physically touching them, they're not responding at all. And E for eyes is the pupils will be very constricted and small because of how the opioid is working in their brain. We have another acronym, the Scare Me Protocol, that will greatly increase the chance of saving a life if someone's experiencing an overdose. S is for stimulation. In this step, you're going to clap your hands and call out the person. Say something like, "Hello, are you okay?" If they don't respond, you're going to take your fist and place it onto their sternum and rub in circles. If they do not respond to this either, they are unresponsive and you will want to move to the next step. The next step is C, for call for help. If you're in a public area and there's anyone near you, call out to the closest person you see. For example, "Hello, guy in the red shirt, can you please come here and call 911? I think this person is unresponsive." If you are in a private place or there isn't anyone around, you're going to want to call 911 before you go into any other step. You're going to call 911. Once they are called, go back to the person and go to the next step. If you have Narcan on you and you have a Narcan kit, you can skip all the way down to step M where you're giving them and administering the Narcan. The next step is A for airway. You're going to grab your Narcan kit and open up the gloves. Put both gloves on your hands and go down to the person's head. You'll open their mouth and take 2 fingers and swipe each cheek to make sure that there is nothing blocking their airway. Sometimes they may vomit and you're going to want to make sure that their airway is clear before you go to the next step. R is for rescue breathing. As mentioned previously, if you have Narcan, you should have already administered the Narcan by now. However, if you do not have Narcan, this is when you're going to continue doing rescue breathing until help arrives. So in order to do rescue breathing, you're going to go onto your knees, you're going to put both hands on the sides of their head, tilt their head so that they have an open airflow, and place the one-way valve onto their face. Make sure the tube is in their mouth. You're going to pinch their nose closed and start doing rescue breathing. They need 1 breath every 5 seconds. So the counting would sound something like this. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, breath. 2. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, breath. And you're going to be doing that until help arrives, unless you have Narcan, because that's when you would administer a second dose. E is for evaluation. Now, step R and step E are very similar, and you're kind of doing them both at the same time. So as I said in step R, where you're going to be checking every 3 minutes if they've become responsive, this is part of the evaluation. The evaluation is basically seeing if they're becoming responsive. If they're not responsive, you're going to continue using your steps of rescue breathing and or administering Narcan. M is for mucosal atomization, which is the Narcan nasal spray. If you're coming from step C, which is call for help, you're going to administer your first dose of Narcan into their nose. You'll take the Narcan nasal spray and put it into their nose. Make sure that you do not put your finger on the plunger until it is in their nose. Once the Narcan is in their nose, you'll put your thumb onto the plunger and inject into the nose. After this step, you'll go back to your rescue breathing. Within 3 minutes, you should see if the Narcan has worked. So do the rescue breathing for 3 minutes. As I said before, you'll be doing those 1 breath every 5 seconds, and 3 minutes is kind of hard to calculate when you're in a really stressful situation, so try to count to 36 breaths. If after 3 minutes, or the 36 breaths, the person is still unresponsive, you're going to go back into your Narcan kit, and there should be a second dose of Narcan. You'll take that dose, and again, make sure you don't put your finger onto the plunger before you put it into their nose, but you're going to put the nasal spray into the other nostril this time. So put it into the nostril, put your finger on the plunger, and administer the second dose. Again, it's going to take about 3 minutes to set in, so go back to your position for rescue breathing. Do the rescue breathing for another 3 minutes, or as I said before, about 36 breaths, and see if the person has become responsive. If the person has not become responsive even after 2 doses, you still can administer Narcan. If you have more than 2, administer the Narcan again into the other nostril. However, if you are out of doses, continue to do rescue breathing until help arrives. And the final step is E, evaluation. Again, this depends on each situation. If the person is still unconscious, you're going to evaluate that you need to continue to do rescue breaths until help comes. If the person does become responsive, they're going to be in a little bit of shock. They just came out of an overdose. So speak calmly, quietly, and let them know that you're there for them. They may want to leave and go off and do their own thing. However, you want to make sure that they stay with you until help arrives so that they can get the care that they need. Usually, after a person comes out of an overdose, they have a very high risk of overdosing again. So you want to stay with them and make sure that they don't use again for at least an hour and that they don't overdose again in that time. You now have all of the information you need to know on how to use Narcan and what to do in the case of an overdose. On behalf of our partners, we want to thank you so much for participating in this training, and a special thanks to the Battle Creek Community Foundation for putting all of this together. Thank you so much for learning how to save a life.